Welcome technicians. Today we look into emergency codes in our hospital laboratory. So first and the foremost thing we need to do is the code blue. Code blue stands for medical emergency. Means somebody might have gotten into syncopal attack, or he might have become unconscious. Patient may be having fits, or patient may be having a severe chest pain and has fallen down, or even a patient who is walking may have suddenly collapsed. So whatever may be the reason, so you have to announce the medical emergency. So how to announce the code blue? First and the foremost thing, you have to tell it is code blue. You have to tell which is the floor and which is the place. Okay, so this you have to do it 3 times. So for example, code blue, the floor, the place, and then you wait for 5-6 seconds, and then again repeat the same code blue, floor, place, again wait, and again you announce. So like that. See, for example, if it is happens in our lab, then you announce as code blue, 3rd floor, laboratory, code blue, 3rd floor, laboratory, code blue, 3rd floor, laboratory, like that. Your pronunciation should be very good. You should be loud enough so that everybody in the hospital can hear it. So these are important things. Don't be shy. Don't be tell it in a very timid tone or anything. Be aggressive. Tell it in a good voice. Okay, that is very important. Now with respect to our laboratory alone, so let us say that if it happens in our sample collection area, one of the technician from the 3rd floor lab has to go down to the sample collection area and see exactly what has happened, so that they should not become a nuisance there. Don't try to act too smart and don't try to find out exactly what happened. Just stand there, observe. If there is a CPR going on and they are struggling, you can help them how to with the CPR and all. And if already the team has arrived and they are taking care of, just find out exactly what has happened and report it back to the laboratory so that the lab can take the necessary steps that needs to be taken. Okay, that one important thing you have to remember. Repeatedly we have seen that whenever a particular staff announces a code blue or a code red or whichever code it is, they just simply sit tight, making sure, waiting for the team to come and do whatever is necessary. It is not like that. Whenever you announce a particular code, you have to make sure that the necessity things that has to be done before the arrival of the respective team, you have to take care. For example, if a code blue has happened, you have announced and you start doing the CPR. So make sure that your CPR, you are aware of the CPR and you start doing it. And once the team comes, they will take over. But even when they take over also, you may have to give the history, exactly what has happened, how did you find the patient, what was the patient suffering from, or whether if has a convulsions or he was just walking and fell down, whatever. All these details you have to give. So don't act like a bystander. Okay, you are you are part of that active code. So be sensitive about that particular part. Okay, if it happens in a 3rd floor laboratory, then there are many people will be there in that. So you have to act in a group. For example, one person has to do a CPR, another person has to go and announce the code blue, and 2 people should engage in doing the CPR and others should give space. Not like they keep surrounding and who like that. No, they have to give space so that it can be taken care. One of the person can go out and help the incoming code blue team where exactly to go and all. So like that, you have to coordinate each other. Not like you announce a code blue and sit on the table and you wait. No, that is not the correct way. Okay, so let us see about the code red. Code red is a fire emergency. So again, what you do, you take the intercom telephone, call 7777 and you announce in a similar way, code red, floor and the place. So you announce it 3 times with a 5 to 6 seconds of gap in between, and you have to clearly tell it. The tone should be proper and you should be aggressively tell it, not like in a timid way or anything like that. And 3 times you have to tell. So how exactly to handle code red and all, I will discuss as a part of the fire management. So we'll look into that. Okay. Code pink basically stands for infant or abduction or a child missing. So here also you have to call 777, tell code pink, floor and the place, right? Code. So 3 times with a 5 to 10 seconds of gap. Now again, once you announce, don't sit back. Try to find out who is the child, male baby, female baby, what dress the baby was wearing, how old is the baby, whether fair, dark, all these details you can try to get it from the people who are searching for the baby, or the relatives or anybody it is. So don't be a passive person, but be an active person. Now once you know those details, so you tell the incoming team exactly what you have found out, which is the child, all those things and all, so that it can be better coordinated. So don't be just an announcer of a code. Okay, so you can inform the MOD, you can inform the security, so all these things you can do, but do not become a hearsay person. Okay, don't give informations without actually having a knowledge of it. Okay, now code orange is basically a code for major spills. So again, you call 777 and you announce the code orange 3 times, the floor and the place where exactly it has happened. And again, code orange is a major spill, minor spills. It's a separate topic by itself, so we will discuss it as a separate. Okay, now the next one is the code yellow. Code yellow stands for external as well as internal disasters. Again, how you announce it? You announce code yellow, floor and the place 3 times with 5 to 10 seconds of gap. Okay, now what are these external disasters or what are these internal disasters? So external disasters may be related to the infrastructure of the hospital or a particular thing. For example, some falling of the floor of a particular roof, or pipe being broken, or water flooding inside the hospital. All these things can be a part of the internal disaster. Here there can be an outbreak of diarrhea, there can be food poisoning in the canteen, because of which many staffs are going to suffer. So all these things, you can take it as a internal disaster. Okay, whereas in case of external disaster, since Mangalore being a semi-metropolitan like city like that, so you can have a sudden a road traffic accident in the area, so many patients may be rushing into the hospital, or there can be a drowning because the river is nearby, so the boat or something might have drowned. So because of that, many people would have exposed to water, so they all may be being brought into the hospital, right? So like that, a plane crash might have happened. So many other externals are there. So external and internal disasters, for both we have code yellow. Okay, so what we need to do as a laboratory person, first and the foremost thing, make sure that every laboratory staff is available in the hospital. So don't take any lunch break, or don't take any tea break, or if there is a shift change, please don't take it. So be there. Let the shift people who are coming into the hospital, let them come. But those who have to go out, don't go out. You wait. So listen to the seniors, what exactly the situation, what actions to be taken, and also don't just leave the place. Make sure that the full strength of the staffs are present. Okay. Meanwhile, check the instruments, make sure that every instruments are available, every reagent is up to the mark, any calibrations, everything is there, all those things are taken care of, so that a flood of patients, if they come into the laboratory, you can able to manage all the respective tests. Now commonly, what is the situation that may become? One of the commonest thing is the blood group, because lot of bleeding might have happened, so a lot of bleeding related and patients may come, so you have to make sure that you have a good amount of blood components present in the section. You have a good amount of reagents to check their blood group and all may be present, right? And apart from that, since in case of such things, identification of the patient may become a problem. So most of the times, from the emergency department, they have a coding. Based on that, they send the patient samples like emergency 1, emergency 2, like that. So based on that, the identification of the patient is going to happen. So you have to stick to those numbers. You cannot change the numbers to whatever you feel like, because the patient's name is not there. So you have to stick to their numbers, and whatever the samples you are running in the lab, they all should coincide with the number what the emergency department has created. And once you start doing it all, make sure that every staffs are available, every staff is working, and never believe or never talk to strangers about what exactly is happening. Or oh, so many patients came, oh, so much such a thing happened, this thing. Never talk about it. All these things will be taken care by people who are who have been assigned for such jobs. So media handling, that handling, this handling and all. Your job is to make sure that whatever laboratories samples and other things has to be handled, you handle that correctly. Okay. So there will be more training sessions on code yellow and all. You can go through it, and as per that you can understand. Okay. So next is the code white. So in case of code white, it is nothing but an aggressive behavior of the patient relatives for many reasons. They may not be happy with the service, they may not be happy with the bills, they may not be happy with whatever may be the reason. Again, how do? You call 7777, you tell the code white, floor and the place 3 times. Again, similar things and all. Now if it happens in front of you, so you may have to take an action, or sometimes keeping silent also matters. So being most of our lab staffs are being females, so it is better that you keep silent, give space. Okay, make sure that the code white team arrives at the place, and if you are alone, try to go into a room or something where you can lock yourself without anybody trying to hurt you physically or anything. So if the person is not physically aggressive, don't try to talk to him. You just give a smile, give a space and announce it, and wait for the team to come. Don't try to take the situation into your hands. If the person is physically abusive or physically aggressive and all, try to lock yourself in, so that you physically you can protect yourself. Meanwhile, alert the other staffs also in the vicinity, so that no further harm comes. Always protect yourself than the property. This is very important. Okay, protecting yourself is far more important. If they are damaging little bit of property also, it is okay, but that can be taken care of at the later time. But always protect yourself. This is very important. So wait for the team to come and they will handle it. Okay, don't try to give some answers or some vague things and all and get into trouble. Okay, so these are all some of the codes which we use. So hope you are able to understand. So in the actual classes and all, you will learn more about it. This is more of an introduction to know exactly how the things works. Okay, thank you.